very, very excited. I want a very, very warm welcome for Jodi Waugh.
Yeah, I feel actually overwhelmed with gratitude to be here. It's so nice to talk about what I do, because I feel like it's so unknown, and actually it's really important to understand that sometimes when you have aches and pains, it's not always a structural thing. So I've been an osteopath now for 17 years, and I've been practicing NeuroEmotional Technique, this type of kinesiology, for about 12. Can I just have a show of hands? How many people have been to an osteopath? Oh, cool. Okay, great. All right, I will explain what it is for everyone else, but that's great. Has anyone been to a kinesiology practitioner or like done any kind of muscle testing? Yeah, okay, great. Okay, cool. All right, okay, so for those who aren't familiar, okay, actually, so what we'll be covering today is I'll explain what osteopathy is and neuroemotional technique, and but actually we're going to be covering 4 case studies, because that's the most interesting way to talk about these things. And then actually we're going to be doing some practical exercises as well. Some of you, if you do yoga, you might have done some of these before. So alternate nostril breathing, and then I'm actually going to teach you. I'm going to teach you all a technique of how to muscle test yourself next time you have pain to check if there's an emotional component, which is always useful and interesting. Okay, so an osteopath, someone who solves problems you don't know you have in ways you can't understand. This is the definition floating around online at the moment, and it is relevant. It's fair. So osteopaths use a range of techniques, from the very subtle, and even if I go and see a fellow osteopath and I'm having a treatment, sometimes I'm like, "What are you doing there?" And so this is fair. And then the techniques range through all the way to the really direct techniques, which you'll definitely feel, like the manipulation and the stretching and things like that. So the aim with an osteopathic treatment is always to increase circulation to different areas and just reduce any of the tension in the body so that we can, move freely and enjoy ourselves. So neuroemotional technique, it's a little bit more difficult to explain, but I just find it like completely fascinating. I was working for like 3 or 4 years, and like everything was kind of going along fine, but there were maybe 30–40% of patients who I'd be treating, and they'd get a little bit better, but I'd talk to them about their lives, and I'd be like, there's just some emotional kind of issues here, or some factors in their life that haven't been resolved, and I didn't really have a way of accessing it or treating it. And then so I started looking into things, started looking into like counseling or psychotherapy or psychoanalysis, and I was like, oh, what's something else that I want to add to my toolbox? And then and just by chance I had like stomach pain one day, and I went in to see a woman who I work with, and she does bicom and bioresonance and stuff like that, and she said, oh, you've got stomach pain, well, why don't we just muscle test that and see if there's an emotional component? And I was kind of like, what, you can do that? And so then I really clicked. I was like, this is what I want to do. But anyway, prior to learning NET, I thought that emotions were like these kind of amorphous things that hung around us with not a lot of organization. And but actually, like when you look at the 5-element theory from traditional Chinese medicine, it's amazing. So every single human being, if they feel anger, and particularly if they store anger, they're going to store anger in this meridian, exactly this meridian. And then the other feelings that will store in this meridian are feelings like feeling emotionally repressed, not being able to express yourself, frustration. Yeah, so emotions are very organized, and the fact that they're very organized and they exist in specific meridians means that we can test them. Can I have a volunteer? Would you mind coming and standing Okay, so just give me a wave if you can't hear me for now. So in the clinic, what I would normally do is like say if you had right shoulder pain. So this is how I would normally test it. So I would get you to bring your arm up like this. Okay, so you're going to hold your arm firmly. Don't let me push down.
Okay, straight up. Or...
hold it a little bit lower. Okay, so I would put my hand on the shoulder. So at the moment I'm testing structure. So, okay, hold strong. Okay, and then so we've connected with the shoulder. And then these are the emotional points just across the forehead. Do you mind if I touch you?
Of course.
Okay, so you put your hand across the forehead and then you check again. Hold strong. Okay, so in this test, if there's a difference, then you know there's an emotional component of the structural pain. And that's how easy it is. And then what you can see here is, so there's a representation of each of the meridians on the wrist. And then so say, sorry, what was your name?
Ling.
Ling. So say Ling tested positive for an emotion. I would then say, okay, well, let's go looking for what the emotion is, and then we can check.
I've got tons of emotions.
So I would check then by muscle testing each of the meridian points at the wrist, and then you isolate the feeling, and then you would find the memory from which the feeling came from, and then do you want to have a seat here? So then how I would direct someone, normally I have the table set up so it's a very comfortable process, but anyway, so I would direct the person to come, bring their hand around here, and then hold on to, say it's this meridian point. So you would hold on to that one with your finger, yep. And then you'd place your hand long ways across your forehead to contact the emotional points, and I have pillows and things like that. But then what you would do is you would watch the memory play out in your mind. So you'd access the cognitive memory, so you'd watch it play out, and you'd just allow yourself to feel the feelings in your body that you felt at the time the experience occurred. And you can relax now. Thank you so much, Ling. Okay, yeah, so so that's how it works. And you might be wondering now, well, why do emotions store, and when does it even become a problem? And it's a really, so emotion storing in the Meridian system is a really functional part of life. We can't go around kind of hysterically or losing the plot anytime something sort of slightly upsetting happens. So, so it's functional. So you store the feeling and then you deal with it later. What normally happens and how people will naturally process feelings is you'll just be sitting somewhere quietly, and the energy will move from the meridian up to the brain. So you'll think about it, you'll feel the feelings, you'll think about it, you'll feel the feelings, and just that movement of the emotion up to the brain, back into the meridian, so thinking and feeling about it will dissipate the store of energy. The problem happens is when you go through something like an experience that's traumatic or emotionally stressful. If you go through something like that and then say you're moving countries or you're starting a new job, or for whatever reason you just don't have time to kind of reflect on the process and process the feelings naturally, what will happen is there'll be a store of emotion, and how that can present in your life. So say you have a store of unresolved anger. So you might find that in your day-to-day life, you'll have you might have a little outburst at something that's trivial, and you'll kind of notice it in yourself. Afterwards, you'll be like, oh, why did I react like that? It wasn't really that much of a big deal. Or if you make a small mistake at work, if you have a store of a feeling of low self-esteem or worry or something like that, then you might make a small mistake at work or something like that, and then you'll have an overwhelming sense of incompetence about it. So it's when the response isn't proportional to the experience in the moment. So we're going to demonstrate external world pressures. So external world pressures are things like workload, It's things like your personal reputation, it's what people think of you, and it's a common stress for everyone because these are basically factors that affect everyone. So for people who are high achievers and perfectionists and people who put a lot of pressure on themselves, these pressures are very real. So this case was really memorable for me because this girl is only 16 years old, and at the time I saw her, she'd been suffering stomach pain and gastroesophageal reflux for 5 years. Gastroesophageal reflux, or GERD, or heartburn reflux, however you want to call it, happens when, so there's a little sphincter here at the bottom of the esophagus, between the esophagus and the stomach. It's actually quite a low pressure sphincter. So any kind of additional pressure in the stomach will push acid up the esophagus. And the other way it can happen, so feelings like worry and anxiety will store in the stomach and increase the pressure here. The other symptom that people often describe is feeling like they'll have a meal and they say it just feels like it doesn't go down at all. And that's the other symptom, and that relates to the sphincter at this end. So sometimes this sphincter can tighten up, and you get what's called like delayed gastric emptying, and but it has the same result, causes the acid in the esophagus. So just to talk a little bit about general stress, because it relates to the exercise we're going to do. When we put ourselves under pressure, we'll slightly inflate the lungs. So that means that when you lie down at night, you don't actually do a full exhalation. So you might be lying down, ready to go to sleep. And it's a good test actually. So you just breathe in and then and see if you do like a full exhalation. So why we do that? It's physiologically effective in the moment because you slightly inflate your lungs and it supports the heart to beat faster and contract harder. So the issue is kind of if this state is held for a long period of time, because then the body normalizes to it. So what I found with her is the stomach stress. So I did osteopathic technique, but then we did kinesiology. I was like, well, there must be something that happened. So 5 years ago, it turned out that she moved to a new school, and she was unfortunately bullied by a group of girls. It was just around that age, and so another one of the feelings that came up for her, which also stores in the stomach spleen meridian, was a lack of control over events. So if you don't know when you're going to be bullied or when you might see these people or things like that, or even just not being able to control the school environment, that can be a stress. Who wants to do some exercises? So this is alternate nostril breathing. This technique is amazing. I used to recommend the box breathing, but then I discovered this one, and it really is like, it's a game changer. So if you could all hold your hands like this. Okay. And then place your 2 fingers, yep. And then so you're going to gently block off your right nostril and breathe in through your left. And then block off your left and then breathe out through your right. And then pause here and wait until you feel like breathing in again, and breathe in through the right. And then block off the right and then breathe out through the left. So just in your own time, do one more cycle of that, just so you can really feel the effects. Okay. And you can carry on doing it if you like. So what this does is it fully expands the lung fields, and also you have to do a full exhalation. And because you're only breathing through one nostril, you take like a deeper breath, and and yeah, it's just a great technique. It's also been shown in research. It's been proven to reduce blood pressure, and particularly like the diastolic blood pressure, which is when the heart muscle is relaxing. And that's an important measure because it's kind of indicating the residual stress in the system. Oh yeah. And the other breath you can do, it's a simple one, but if you put your hand on your heart and on your stomach before you go to sleep at night, and this really gives you the idea of if your breath is catching anywhere, and you just breathe in like, and just really let all the air out of your lungs. And do it as many times as you need to, like have a really smooth out breath. Like actually our exhalation should be completely effortless, or it can be. So that's a nice thing to do before you go to sleep, because you can actually sleep in a stress state, which is, not the ideal sleep that you want. Okay, so for the second case study, this is a really recent one, and it was really interesting. So I was treating this woman. Do you guys know the minimalist shoes that are like a lot of people are wearing these days? They're like Vibram, like minimalist, and anyway, they are great shoes. They're really great shoes for natural surfaces. So if you're going to be running around on dirt trails and things like that, like cool. But please don't wear them like 100% of the time on concrete in town, on concrete trails. Anyway, so I was treating this woman, and she loves these shoes. And I was like, please, can you just wear like your proper sneakers when you're on the concrete? And she came in, and she had pain. She had pain on the underside of her foot, like on the ball of the foot. And it totally made sense to me structurally. I was like, yep, you've been running around with your shoes. Her foot on the left side had she had a bunion, she had a couple of other things going on. So completely made sense to me. So I treated her 3 times, and she would get better for a couple of days, the pain would come back. And then the 4th time I was like, all right, like this makes sense to me from a structural perspective, but let's just see what's going on with you emotionally. And we checked it, and like sure enough, there was an emotional component of her foot pain. And so the feelings that came up were fear and paralyzed will for her. And she has a great relationship with her youngest son, great relationship with all of them, but she's particularly close to her youngest son. Her youngest son is in his 20s. He's kind of finding his way in life. He's sort of going through a bit of a struggle patch, I guess. And he loves his mother, and he listens to every word that she says. And so he calls her up for advice, and she's like, oh my gosh, my son listens to every word I say. He is going to take whatever advice I give him. And she has this overwhelming kind of pressure of making sure that she says exactly the right thing that he needs to hear, that's going to move him along in his like sort of successful life path. And I was messaging her just to ask if I could talk about her case, and I was just refreshing on exactly the feelings. And she was like, it was a fear of failing my son and causing him hurt in his life. So some pretty heavy feelings. But anyway, check out where the fear and paralyzed will store in the bladder kidney meridian, and like check out where that meridian goes. Like this was 100% exactly where she had her pain. I was blown away. Anyway, so we've just got 2 more case studies. So this one doesn't relate to kinesiology, but it was an interesting, a really interesting observation quite early on in my career. So I treated this woman, she's 32, she'd had a baby 2 years before, and she was suffering from chronic lower back pain, and she wanted to return to work. And when I treated her, the first time, I found all the things that are kind of common to chronic lower back pain. But what I also noticed with her is that from her midriff down, there was like nothing happening. I couldn't feel. So these are kind of like, this is what you palpate. So you feel all these different rhythms in the body, and the most subtle one is the craniosacral rhythm. But basically, like when you put your hands on someone, there's like a feeling of life or vitality or whatever. So with her, there was almost nothing just from here down. And I kind of puzzled over it at the first session, but she was quite shy. And what she told me about her birth is she said, oh, it was a little bit traumatic, but it was like, fairly normal. And then at the second session, I thought I'm just going to ask her about this. So I told her what I could feel in her body. And I said, is there any reason for it? Like, do you have any ideas? And then she opened up and she said, actually, the birth was extremely traumatic and I've had several surgeries and essentially the surgeries are not taking, I'm not healing well, and I'm just completely sick of it. And she had unconsciously kind of shut herself off from this part of her body that was trying to heal. And this was the first time I'd encountered this in my practice, and I wasn't quite sure how to kind of like bring back this flow because it's a really internally moderated thing. So what I got her to do is intentionally embrace these parts of herself that were essentially in a healing process. And I also got her to do the smiling meditation, which brings us to our next exercise. So the smiling meditation, if you want to read more about it, comes from, there's a guy called Mantak Chia who writes about it. The exercise, so if you smile at someone, and if somebody smiles at you, there's an energy exchange. So you feel good because they're actually sending you energy. So with this meditation, you keep your eyes closed and you have a little smile on your lips, but you smile with your eyes. And if you do it for long enough, you'll start to feel this nice, warm energy build up behind your eyes, and you can send it anywhere in your body. Or even if you're just having a low day, you can actually just do the smiling meditation and it's kind of like shining a light in your brain. Anyway, so everyone just like sit in a comfortable position, and then Doreen, no one's looking at you, just close your eyes, have a little smile on your lips, and think of something that you really love or someone that you really love, and just build up that nice warm energy behind your eyes, and intentionally soften your eyes in the eye sockets. And we'll just do this for like another 30 seconds. Just see if you can, just see what you observe. Okay, actually I hardly want to interrupt anyone, but I'll just carry on my talk. But so one really nice thing to do at the end of the day, if you have had a stressful day, sit, close your eyes, go inside, go, okay, how did I feel about my day? And allow yourself to feel the feelings that are there. Like rather than like picking up your phone or, like actually just sit with the feelings. They cannot hurt you there. And actually sitting with them and even just observing them in your body will dissipate the energy. And so the last but not least is the liver meridian and repressed emotions. So repressed emotions are really interesting because it's often a feeling that you're not proud to have. So, none of us are perfect. You go through life and you often have a feeling that you may not be proud of having, might be jealousy or envy or whatever. Anyway, so with Sally, I saw her and in the first session I just noticed that there was a lot of congestion around her liver. And there can be lots of reasons for congestion around the liver. It can be alcohol or, previous like glandular fever infections or or like gastrointestinal bugs, anything. So checked all those, wasn't that. And then I just started asking her about what was happening in her life. And she was the godmother to a girl who had been living in America, and sadly her friend passed away, and she was in the process of adopting this girl so that she could come and live with her. And although her friend should have known better based on the industry that she was in, etc., she was having to go through this much lengthier court process and a much more costly process in order to adopt this girl and have her in Hong Kong. And she just didn't know why, like, the more simple process wasn't the option. And so she was angry at her friend, but unable to feel that anger at her friend because her friend had passed away. And so this is what she was kind of repressing. She didn't want to kind of have that emotional experience. So in conclusion, if you have any of these feelings, the best thing to do is not judge them too much and go, yeah, I feel that way, whatever. Means that it sort of stops the layering and the complexity. And also our feelings don't define us. And then, also have a loving attitude towards any part of your body that is in a healing process. And next time you have pain, be curious and muscle test it. Okay, so the way you test pain is, say I have right hip pain. So there's a number of different ways to muscle test on yourself. So some people do the ring test. So everyone pinch your thumb and your index finger together. And so try and slide your other index finger through the hole, like try and break the seal. Okay, so if you can break the seal, that indicates a weak response, and then if you can't, that indicates a strong response. So it's not an exact science, obviously, but it is good to use. I mean, if there's how I use it is if I'm looking at different supplements to take, I already kind of know roughly why I need to take the supplements. But if I'm trying to decide between brands and dosages and things like that, sometimes I'll do this just to kind of get more of an idea, because you bring the item within your field of energy, and that's how it works. But so there's that way. There's also this way, so you can keep your index finger strong and straight, and then try to bend it. If it stays strong and straight, that's strong. And then if it bends, that's weak. And that's actually the way that I do muscle testing. So if I had right hip pain, I'd put my hand here and I'd go, I'd be checking the structure. I'd be like, oh, how's the structure? And I'd just test like that. And then still in contact with the hip. These are the emotional points on the forehead. So to test the emotions, I would just put my hand long ways across my forehead, and then I'd test again. So if there's a difference, if it's strong and then weak, or weak and then strong, that means that there's an emotional component. If they stay the same strength when you're testing, you look confused. If it stays the same, it means that there's not an emotional component and it's just a structural issue. And if there is an emotional component, then just meditate on it. Connect these points, close your eyes, tune in, and just have an internal dialogue. Just be like, what's happening here? And you might have a memory come up, you might have feelings come up, and then you can process it yourself.
Well done. Interesting. So when you get a patient, you start with a physical check, and if you believe that there's something more, then you start with an emotional check?
Mm-hmm. Yeah, generally speaking. So normally I would treat some, unless they come in and they specifically want the NET to start with, because I'm an osteopath primarily, so I will normally assess them osteopathically. There's also a way you can work with emotions anyway with the osteopathic treatment, but I find the NET the most direct. I would normally do structural treatment first and then look into the emotional side of things after.
Cool. Are there any questions?
Hi, Jodi. Thanks for your talk. I just wanted to know, when you say like weak response and strong response, so if I'm putting here, and if there's emotions, will it bend or will it stay straight?
So say if you check your hip and you go test, and it's so it's more about the change. So if it's weak, that can indicate that there's a structural issue. If it's strong, muscle testing is a bit confused. It's more about the change. So if you test it and it's either weak or strong, and then you check the emotional points, and it changes, that's what indicates there's an emotional component.
Wondering if you come up with any of these like dietary / environmental things like around you. Like for example, he also said that he had another patient who had pain because there was a candle that was burning in her office.
Oh, interesting.
Some kind of headaches or something like they need.
Yeah, the chemical sensitivity.
Yeah. So just wondering if that's, because I think a lot of people do get pain because of diet, and they get pain because of so many different things that you don't have no idea about.
Yeah, diet is huge. Yeah, it's not only. I mean, I covered the emotional stuff today because I kind of find it the most interesting, but actually diet is huge, and the reason why it's huge is that there is a lot of seed oils in the food that we eat, and it actually skews your body towards producing more inflammation. I actually used to work with a woman, and she was like 65 or something. She'd completely mashed her the menisci in her knee doing a big hike, and she was in pain like pretty much constantly. She changed her diet. She actually went plant-based, which I don't think was the key. I think it was the key of taking out like the seed oils and gluten and some of these common inflammatory agents. But yeah, dairy, gluten are the common ones. But yeah, that's why omega-3s are so powerful. Like it's balancing out. It's actually just shifting the biochemistry in your body so that you can't produce inflammation.
Oils. Avoid oils.
Yeah, avoid seed oils.
They're so good.
I know, exactly right. So seed oils are in all the chips, all the things that you crave when you're a bit tired. Yeah, they are really good.
Okay, we have time for one more question.
Hi, this is Meridian. Thank you so much for the presentation. I'm kind of curious to understand when do we actually approach a practitioner like you, right? Because when do you actually decide, is it physio, is it a counseling, or because to be honest, before the session I never heard about this term. So this is my first time exposure to this. So that's why I'm kind of curious, when do you actually decide to approach people like you?
Okay. I mean, most of the people I see in clinic, they've experienced pain for a little while and they're like, is it going away? Is it persisting? So like within the realm of people who do manual therapy, like there's chiropractors, there's osteopaths, there's physios, and I really love working with physiotherapists. So physiotherapists have a complete different model and approach to osteopaths. So so physiotherapists are amazing. Like when you have a specific injury and you need a rehab protocol, they're really, really well trained with rehab protocols. Like for osteopaths, we are really well trained in finding and treating like structural restrictions in the body. So if you have something that comes about that's a little bit mysterious and you're like, why am I even feeling this? Like that's kind of a good time to see an osteopath. And otherwise, I mean, occasionally I'll see people because they want alignment for a specific purpose. Like I've seen someone who's doing weightlifting and they wanted to be exactly symmetrical for the competition and things like that. So you can go for like structural kind of, structural alignment and stuff like that as well. Yeah. Cool. Thank you so much. It's been an amazing audience.
Thank you very much, Jodi. One more second.
Thank you.
Jodi.
Oh.
Thank you all. But it's time for a little gift, not from me, but from Nick, our paper cutting artist. What did you make this time? Wow.
Oh my gosh, that is so cool.
I did have to do a little bit of research about what your job is. But it seemed like it was a lot of holistic muscle and bone treatments, and then kind of looking at the whole body. So I wanted to represent that, and I was predicting that you would have similar diagrams that you had in your presentation. So a little bit of projection there.
Oh my gosh, thank you so much.
One more round of applause for Jodi. Thank you so much.
Thanks so much.